Yeah, myself, Dr. Ehsan Ahmed. I'm working here as medical and health officer in Karimganj Civil Hospital, Assam. So in today's session, we'll discuss about the heart attack, its causes, and preventive measures that are required to avoid a heart attack. So nowadays, we often come to know that the person died due to heart attack, even at the age as young as 30 and 40 years. So incidents of such heart attack and the number of deaths due to it are consistently increasing in our country in India. So let's understand what is heart attack and what can be the reason behind it. So heart, as we know, is the most essential organ, and its non-stop functioning is crucial for survival. It functions like a pump and allows the circulation of blood throughout the body. Blood is circulated through the extensive network of various types of small and large blood vessels. Blood ultimately provides all the nutrition and oxygen supply to various organs which are necessary for normal functioning of the particular organ. Now, the muscles of the heart are continuously contracting and relaxing to pump the blood into the blood vessels. This pumping of the heart leads to what we can hear as the heartbeat. So, on an average, in an healthy, normal person, the heart beats for about 72 times in a minute. This means heart muscle contracts and relaxes 72 times every minute. So to do such an extensive work non-stop without any interruption, it requires continuous supply of oxygen. So for these, heart has its own network of blood vessels around it, which continuously supply oxygen to the various heart muscles. Any interruption of blood or oxygen supply to the heart for even a few seconds can impair its function, and this leads to heart failure or what we call a heart attack. So basically, a heart attack occurs when a blood vessels supplying the blood to the heart are blocked in some way. So let's understand why there is a blockage of blood vessels. The main reason behind such incidents is increased blood pressure and excess of cholesterol or fat deposition in these blood vessels. Now, persistent high blood pressure damages the blood vessels by making them more rigid and by damaging their inner walls. Now, what does this inner walls, it increases the risk of cholesterol or fat deposition in these blood vessels. So when there is excessive fats, it get deposited in these inner walls of the blood vessels and it blocks the blood flow. Due to these blockages, heart of the person with high blood pressure has to work harder to pump the blood throughout the body. This increases the workload and oxygen demand of the heart. The increased demand and lower supply of oxygen to the blockages ultimately lead to the failure of heart function. So a heart attack can cause multiple symptoms. What are those symptoms? Chest pain is the most common symptoms of a heart attack. There can also be feeling of an uncomfortable pressure, aching, numbness, squeezing, fullness, or pain in your chest. Uh, the discomfort can spread to your arms, jaw, or neck, or even to the back. It can last for several minutes, or it can come and go. However, it's not the only symptom. Like chest pain is not the only symptom of a heart attack. Possible symptoms of heart attack include dizziness or fainting, lightheadedness, nausea, indigestion, vomiting, and shortness of breath. So these heart attack symptoms can be different for each person. No two heart attacks are the same, even in the same person. Person may have just one or a combination of symptoms. Sometimes the symptoms of a heart attack are not the classic crushing chest pain that one thinks of. One may even feel less obvious symptoms, such as just a burning feeling in the chest or a shortness of breath. Sometimes one may undergo no warning sign at all, and this what we call a silent myocardial infarction or silent heart attack. So a heart attack is a medical emergency. A heart attack can only be diagnosed by certain medical tests. The only way to know what you are experiencing is to seek an urgent help. So the medical tests included here are first is the electrocardiogram or the ECG. This can provide information about the extent and the location of the heart muscle damage. It can also direct the heart rate and rhythm and whether or not one is having a heart attack. The next investigation is an electrocardiography. So what it is an ultrasound test that can be used to learn how the heart is pumping overall and what areas might not be pumping normally. The next investigation is a coronary angiography or the coronary catheterization, what is the invasive procedure to perform. It is an invasive procedure which is performed to directly visualize the size and extent of the blockage of the blood vessels of the heart by an X-ray. It is frequently recommended in the first hours of an heart attack if medications are not relieving the symptoms. Next, we have certain blood tests, which are also known as cardiac biomarkers, which can identify an heart attack. So overall, what these tests, these will measure the amount of damage that is caused to the heart by the heart attack, and the best treatment course that can be adopted for such an heart attack. No, a heart attack mostly requires emergency treatment to restore the aim is to restore the blood flow to the vessels of the heart. The faster this happens, the less the heart muscle is damaged. Heart attack treatments may involve medications or surgery. Now, medications that are required to tackle a heart attack are those which prevent blood clots or to stop the platelets from collecting and sticking to the plaque, and to stabilize the plaque and prevent more or further ischemia. Now, these medications are to be taken as soon as possible, preferably within 1 to 2 hours from the start of the symptoms, that is the heart attack, if possible, to limit the heart damage. Now, drugs used during a heart attack include aspirin, which is to stop blood clotting that may take the heart attack to, even worse. Aspirin to stop blood clotting that may make the heart attack worse. Other platelet drugs such as clopidogrel, prasugrel, and ticagrelor to stop clotting. Thrombolytic therapy or busters. Thrombolytic therapy or clot busters like streptokinase and tenecteplase to dissolve blood clots in the heart arteries, or a combination of any of these. Now, other drugs given during or after a heart attack help your heart work better, widen your blood vessels, lower your pain, and help you avoid life-threatening heart rhythms. Now, drug therapies aims to break up or prevent blood clots, stop platelet from collecting and sticking to the plaque, stabilize the plaque, and prevent more ischemia. Now, these medications are to be taken, as I said, within the first 1 or 2 hours from the start of the heart attacks or the symptoms, if possible, to limit the heart damage. Now, what are the lifestyle modification one can adopt to minimize the chance of an heart attack? One can reduce their risk by making positive changes to their lifestyle. These are treating the blood cholesterol. Now, foods higher in saturated fats can contribute to high cholesterol and reduce the blood flow and increases the risk of heart attack. Hence, it is also important to start a heart healthy diet to reduce the risk. Now, limit food high in saturated fats, which comes from animal products such as cheese, fatty meats, and dairy desserts, tropical oils, and highly processed foods. Choose unsaturated fats which don't raise cholesterol levels. One can find unsaturated fats in foods like nuts, fish, vegetable oils, olive oils, and sunflower oils. A diet emphasizes increased intake of fruits, vegetables, whole grains, poultry, fish, and nuts, while curbing sugary foods and beverages. Eating and drinking too much sugar raises the triglyceride level. A heart healthy eating plan can help manage the blood cholesterol level. Next is controlling high blood pressure. Drinking too much alcohol can raise the blood pressure. It can also add extra calories, which may cause weight gain. Cigarette smoking also raises blood pressure and puts you at higher risk for heart attack and stroke. Excess salt intake is also known to raise blood pressure. Reducing these factors can help to reduce further complications of it. Now, one is to follow an exercise plan and maintain an ideal body weight. Regular physical activity makes the heart stronger. If one have a strong and healthy heart, it can pump more blood with less effort, reducing the risk of hypertension and heart failure. Exercise cuts bad cholesterol and raises the good cholesterol levels. One can aim to get 2 hours and 30 minutes of moderate aerobic activity per week, like brisk walking, or 1 hour and 15 minutes of high intensity exercise, such as jogging per week. Monitoring stress levels and getting adequate sleep are also possibly the best ways to prevent heart problems. It is important to remember that we can afford everything, but nothing is as precious as the health. It is possible to make healthy and prevent heart failure or heart attack through lifestyle intervention like dietary modification and exercise. By taking action to lower blood pressure, one can help protect themselves against heart attack. So this much we have discussed about heart attack. Thank you.